I'll give the floor to Dr. Muronda to just quickly give us an overview of really what is PCR testing and, what it entails and, where a lot of this confusion is coming from. And also for him to just give us a run through regarding the systems and the processes that are used at Lancet. And after that, we can start opening up for questions. Doc, over to you, Doc.
Yeah. If you recall, at the beginning of 2020, when reports of COVID started appearing in the news and COVID eventually arrived in Zimbabwe, the main issue was for the public, the Zimbabwean public, to have a path lab that would be available to provide testing services. At the time, I think the government was overwhelmed by the number of requests that they had to deal with. And there was a big gap in the private sector. And I think Lancet took the initiative to start testing for COVID. I would think that without our involvement at the beginning of the arrival of the pandemic in Zimbabwe, I don't think we would be where we are now in terms of the availability of testing services. Lancet is probably the biggest service provider in COVID testing. We test for COVID in Harare and most other cities and towns in Zimbabwe. We do this as a complement, or rather we complement the government because, as we all know, resources are quite limited in Zimbabwe, and therefore, the private sector is very important as far as, bridging, or rather filling the gap, the huge gap. The requests for COVID span from people who are sick, who need treatment for COVID itself. They need to be tested, obviously, to confirm that they have COVID. We also have to provide testing services for patients who may be admitted to hospital for other conditions, for surgery. No hospital is accepting or rather accepts or admits patients without knowing the COVID status for obvious reasons. And of course, people of their own volition might want to know their COVID status. And of course, there's a large proportion of people who travel cross borders. And obviously, there's a requirement for their COVID status to be available at the ports of entry, So without the private sector, not only Lancet, but all the other labs that are providing COVID testing services in Zimbabwe would have a big problem. I think we're very proud that we've actually been able to meet that challenge. And at the moment, I think it's not very difficult for people to access COVID testing services. So, where we are now, I think lately there have been a lot of reports on social media and in the press about the validity of COVID testing, PCR testing. Maybe I can just explain the process of the test itself, from when the sample is collected, and just walk you through what we do in the lab. Now, in this regard, I'm just talking about Lancet. I'm not talking about other labs because obviously people may have different processes. Lancet has various sites that where samples are collected from, but our main collection center is the drive-through, which is at Renan's Hospital. Now, if you know something about collection of samples, the samples that we dominantly use for COVID testing is the nasopharyngeal swab. We insert a swab. I'm sure you know what a swab is. Through the nose and reach the back of the nose, what we call the nasopharynx, and collect secretions from that area, because that is the area that is richest in the virus in quantities. If the virus is actually present in the client. So the nasopharyngeal swab is the ideal place to collect the sample in somebody who is, otherwise well or may have mild symptoms. You can also collect samples from the throat, what we call a throat swab or mouth swab. The throat swab or mouth swab is not as good as the nasopharyngeal swab, because the yield, or rather the viral yield, is much lower. That's why most countries will insist that people that are crossing the borders have had a nasopharyngeal swab and not a throat swab. With time, in people who are sick, the virus tends to migrate into the respiratory tract. That is the air passages. So we can also use what is called bronchoalveolar specimens, where you actually collect secretions from within the lungs and test for the virus. Those are the main sources of or samples that we collect, but predominantly is the nasopharyngeal swab. Now, in collecting the nasopharyngeal swab, the person who's actually taking the swab, he has to be trained to do that. At Lancet, with doctors and nurses who have been trained to take nasopharyngeal swabs. It's not ideal for a person that has not been trained. Whether it's a doctor or a nurse, they actually have to undergo some training to be able to, collect adequate samples. I'll explain why samples are important later on. But, the adequacy of the sample is very, very important in determining the result. So we have trained all the people that are involved in sample collection to a very high standard. So whether the people are operating here in Harare or in Tare or in Bulawayo or Victoria Falls, we make sure that they are trained and are able to collect a nasopharyngeal swab properly. The procedure itself is uncomfortable, but should not be that painful. But of course, pain thresholds vary with people. But we try to do it in a way that the client, does not suffer any long-term consequences from the procedure. Okay. Now, in the lab, one of the most important things is identification of the sample in as far as whose sample it is. So in other words, we want to make sure that Peter's sample is not crossed with Josephine's sample, just to. So at Lancet, we have got a barcoding system. So every sample that is collected has got a barcode. So the barcode is unique to that individual. The barcode has got the barcode and the number, a reference number. Those identification details are unique to the person. So this minimizes the crossing of samples or mixing up of samples. So every person, when they're processed, the first thing we do is that they're given their collection tube, and that tube has got a label with the person's barcode and the patient's name. The barcode has got a number, and the patient's name is also added to that. So this reduces the risk of samples getting mixed up later on in the process. Okay, so the samples are collected by our staff, and the sample is put in what we call the viral transfer media tube. So this tube has got this special substance which keeps the virus viable if it's there. And of course, this VTM is very, very important because if the virus is put in another specimen container without the ideal, or rather the specific solution, it will deteriorate, and of course you will not get the results that you want. Okay. The samples are then obviously taken to the laboratory where we've got automated machines. We don't use any manual procedures. The specimens are then loaded into these machines that are called the thermocyclers. I don't want to bore you with details, but these machines also have got the ability to read the barcode of that person so that the identification of that person is maintained throughout the process. Okay? So the result comes out from this machine with the name of the patient and their barcode number. Those processes cannot be interfered with by an operator. It's not possible. Once the sample with its barcode is loaded into the machine, the end result is specific for that client because of the identification that the sample tube would have. So there's no question of somebody then at the end of that process changing a result. The system does not allow that. Okay. So the results are then fed into our computer system where the printout can then be, printing of the results can be done. And of course, now we actually have got an SMS alert where people that have come through and have samples collected will receive an SMS on their phone to say that your result is ready for collection. And they are told where to go, whether it's at our head office in Blackstone or other branches that also, we dispatch results. Now, what has happened is that the demand for COVID testing has increased tremendously. We had a huge demand last year in July, August, May, June, July, August. At the time, it was mainly people that wanted to know their status. And also, obviously, the pandemic was here and there were a lot of sick people as well. And we had a lot of samples that were coming through. And if I recall, there may be one or two instances where, clients may have complained about this and that. But I think at the time, we managed to process clients adequately with very little, if any problems. And then as borders started to open towards the end of 2020, most countries now were demanding that people that would be coming into their country would have a COVID certificate. Of course, towards the end of the year, with Christmas and the holiday season, there's been a huge demand for COVID testing for people going out and people coming in. To the extent that the number of samples that we process runs into hundreds on a daily basis. We're not testing like 10, 15, 20 samples. We're processing a lot of samples. Just to give you some idea of the magnitude of the work that we're doing. Without this facility being available to the public, I think it would be a completely different a problem that Zimbabweans would face, or people coming in and living in the country. So this service obviously is critical, and we process a lot of samples on a daily basis. And over the time, we've decentralized COVID testing to places like Bulawayo, Vic Falls, because of tourists come in, they want to go and all that. Mutare, Chiredzi, we've got COVID testing now. Our footprint is essentially across the country. Now, the latest challenge that I think the public has had is the reports that some of the results have been challenged by the clients. Most of the clients that have issues with results are clients that would have planned to travel. That's invariably the situation. Somebody has planned to travel, they may have no symptoms or mild symptoms, and then they're faced with a positive result. And obviously, that creates a huge problem if they've got a meeting in Joburg or wherever. The impact of those changes, we've seen that clients just find that very difficult to deal with. And, there's requests sometimes, quite often actually, can you do something about it or whatever, reports that come from my staff. But this is the challenge that people prepare for their journeys, but they don't know their COVID status. And when the COVID status is given to them, they somehow feel that maybe the laboratory is to blame. Now, as I said, we process hundreds and hundreds of clients on a daily basis. These complaints usually do not amount to more than 4 or 5 a day. In fact, it's usually 1 or 2 complaints. Generally, most of the cases that we report as positive, the people just do what they're supposed to do, and that's the end of the matter. But obviously, there are people that feel very strongly that something has gone wrong. Now, one of the things that has happened with COVID is that over the last few months, there are new strains of the virus that have emerged. Viruses are constantly changing, and we call that process mutation. Viruses change for them to survive. If they don't change, of course, scientists will come up with ways and means of dealing with the viruses. So with time, viruses adapt and change and acquire genetic features that then makes it very difficult for the human body to detect that virus. That's why, in fact, things like flu, every year people have got to have a new vaccine for flu, because the flu that we have this year and the flu that we get next year are different types of flu. It's the same virus, but it's changed its genetic constitution. Now, this has happened, as you know, South Africa, Brazil, and the UK, where these mutations in the COVID virus, SARS-CoV-2, have occurred. Now, these mutations pose a challenge because, one, the number of people that are infected gets higher because they are very highly transmissible. The virus has found a way to be readily transmitted to the next person, which means that it infects more people than it would have done in the past. And also, it's been discovered that these new strains have got a higher virulence. In other words, their impact on the person infected is worse than the original COVID virus. Yeah. Now, for people that are testing for COVID in the labs, the PCR, or polymerase chain reaction, what it does is to actually extract genetic material from the virus, okay, and then process that material in an instrument called a thermocycler, okay, to get a result. Obviously, if there's no result, that cycle will tell you there's a result, it will tell you. But now, if the virus has changed its genetic makeup, and the what we call the kits or reagents that you're using to try and detect that virus have not been adapted to be able to pick up the changes in the new virus, you will not be able to pick it up. Okay, and you call that a negative result, when in fact it's a false negative, in that the virus is there, but the system that you're using, or the equipment and the reagent that you're using, are not able to pick up that virus because the virus is mutated, it has changed. Okay, so we have these new viruses, COVID virus mutations that have come on board. And obviously, the thing that we do at Lancet is to move with technology, move with changes in science. And we have, over the last 3 months, through our partners, I think Verify is actually in the meeting, we've actually managed to acquire test kits that can actually detect the viruses that have mutated. Okay, so if you're positive at Lancet, if that person is positive at Lancet and goes on to another lab where they are tested and they're found to be negative, it doesn't mean that the Lancet result is inaccurate or false. It could be that the other lab is not upgraded its equipment and therefore has failed to actually pick up that virus or mutated virus, and they've told this person that you are actually negative when the person is positive. So that is actually a false negative result. So this, I think, is something, this is what is happening in a lot of these instances. In fact, there are publications from FDA which actually say that labs testing for COVID-19 virus must be aware that a lot of false negatives are occurring because of the mutations in the genetic makeup of the virus. Now, of course, this is a complex subject. To explain to somebody The other thing that we must all understand is that a high proportion of people with COVID, infected with COVID, are asymptomatic. By that, I mean that they do not have any symptoms. They are well. They don't have the usual flu-like symptoms that, the typical COVID patients have. These are people that are walking about, they've got the virus, they are well, but they don't know that they've got the virus. So there's a high number of people that are asymptomatic, especially young people. Young people generally, may have mild symptoms or don't feel anything at all. Now, when this person isn't confronted with a positive result, when they are well, they don't have a sore throat, they don't have a headache, they don't have a runny nose, they will say, no, there's something wrong with this. This result is inaccurate. No. The other thing that we talk about in the lab when you do investigations, we talk about the specificity and the sensitivity of a test. Okay? A test which is highly specific means that you will have very few false positives. Okay? So it will pick up that virus if it's there. And with the system that we have at the moment, 98% of the times the virus is picked up. Of course, nothing is 100%. There are so many situations where in a small fraction of people, you can get an erroneous result for a number of other reasons, which I can go to later on. Now, the challenge is where somebody has got a false negative result. Now, here we talk about the sensitivity. The sensitivity of PCR for COVID is not as high as the specificity. So with the sensitivity, you are getting a lot of false negatives. Okay? Now, there are a number of reasons why you can get a false negative result. Right? We start with the clients themselves. If the viral load in the client is very low, the nasopharyngeal swab may not be able to collect enough material to register a positive in the machine. Okay? And if somebody gets sick, the first 2, 3, 4, 5 days of the illness, if you do a PCR test, you may not be able to get a positive result because at that stage, there's not enough viral material for the nasopharyngeal swab to be able to register a positive result in the machine. Okay? So this is to do with the client. The client has got a low viral load either because their disease is minimal, they're at the beginning of the disease and their viral load is low. And then there's a situation where the person taking the swab is not trained properly. So here we've got a nurse or a doctor who may insert a nasopharyngeal swab into the nose, but do not take it to the back of the nose, to the nasopharynx. Okay, now that person obviously has had a swab, but the swab is inadequate, and on the machine, the answer will be a negative, which is a false negative. Okay. Also, some clients opt for a throat swab. A throat swab, as I say, will yield a higher number of false negatives because the quantity of virus in the throat or at the back of the mouth is much less than you'd get if you took a nasopharyngeal swab. Now, in somebody who's not well, the standard in medical practice at the moment is that a negative COVID result does not exclude COVID. This is standard. If you go to St. Anne's Hospital, if somebody is saturating at 90% and they've got chest x-rays that indicate they've got COVID, the doctors are not going to say, you know what, because FEMAS or Lancet or whatever lab have produced a negative COVID result. They'll go with the clinical picture, okay, and then supplement the result because of the pitfalls that are highlighted. That sometimes the PCR, the actual collection of the sample and the other things that happen may result in a sample that is not adequate, or the person does not have enough viral material from where it's collected. So the sensitivity of PCR is low, but the specificity is very high. So a false positive is rare. It means that most positive results are real positive results. Okay. This is something that, as I said before, somebody who's very well, doesn't have any symptoms, may find very difficult to believe or understand, and will think that maybe the lab is faulty in some ways. Okay. Now, if we move into the lab, as I said, you can get false negative results if you have not adapted your processes to be able to detect the new variants of COVID-19. Okay. So you go to Lancet. Lancet has got machinery which detects new variants. You are called out as positive. You then go to another lab immediately after that, and you're called negative. And then you say, oh, Lancet has given me a false positive result. No. You may be asymptomatic, but the result that you got from the other lab is a false negative result. Of course, you're disappointed. You want to travel, and all your arrangements are now in a mess, and you've paid for your ticket and whatever hotels and all that. So you can imagine the amount of stress that this person was through, because this is now has changed their circumstances completely, something that was not expected. And of course, some people are happy to go to social media without engaging the management, so that, the explanations that could maybe give the person an answer were not given the opportunity to discuss the result and what the person should do. Now, one of the most important things that we all obviously are striving to get is that the spread of COVID-19 must be minimized or limited as much as possible. Okay, I would think that if you get a positive COVID result, whether you are happy or unhappy with the result, the first thing you must do is to seek advice professionally. Because the moment you're going around looking for someone else to test you, you're actually spreading the virus and putting other people in jeopardy. Okay, so if your result is positive, whether you believe it or not, the first thing you must do is to do what is recommended by the Ministry of Health. If you are well, then you need to isolate. And now the option of isolating at home is there. You're not going to be put in an institution. You go home and you isolate. And in that isolation process, you make sure that the people that you live with are not exposed, especially if you've got somebody, your parents or grandmothers or grandfathers with comorbidities like diabetes, high blood pressure, and so forth. If you feel that there is an issue with your result, most labs, and Lancet, I can talk on behalf of Lancet, are quite happy, because these samples, we don't throw them away. We're quite happy to run your sample again. We can do that at no extra cost. But this
sorry to interject, Dr. Muronda. Kumbra is trying to extend the meeting so that the journalists can have some time to answer questions.
Okay.
But if any of you lose his connection as she's trying to do that, you will definitely be reconnected. And when we take it up in the next part of this Zoom, we're actually just going to open it up, because I find that a lot of the questions that are coming through from the journalists are that you are bringing up the answers as we go. But it would be great if we can actually have, so if it does cut off, then we will have Kumbirai reconnect us. I think so. For now, what we could do is maybe first of all open up, because I really think you have comprehensively gone into the process of the testing. And I see a lot of comments coming in here where we've got, Michael saying, "Oh, clear now, Doc, you're nailing it." I think you're making it much clearer for everyone here to understand. Limbikani, would you like to take the floor first and maybe pose your first question?
So how far with the investigations of this particular case that has caused us to do this? And then the second one is, what is the, for lack of a better word, market share of testing that Lancet is doing relative to all the tests that are being done in Zimbabwe? Is it 10%? Do you actually know? Is it 50%? Then the third one is, if we assume that if you assume that doctor doesn't know the actual lab that has done a particular test, how confident would he be that a current PCR test held in Zimbabwe, given the mutations, how confident would he be that it is not a false result?
Okay, Lumbikani, is that your name? Lumbikani.
Limbikani.
Limbikani.
Yes.
All right. Thank you very much for those questions. I take it you're referring to this lady called Yvonne Chipuriro.
Correct.
Who posted her issues on social media.
Correct.
Yeah. Obviously, I don't want to go into too much detail on what we're doing. I'd want to start by saying that it's unfortunate that she didn't feel it important to approach managers at Lancet to, convey her dismay at what had gone on. That was very disappointing. But anyway, that's where we are. We do have CCTV at Lancet at head office where she collected her sample. So we've been in touch with her. She has been able to give us, information as to how to identify her. She's given us the time that she came, what she was wearing. So we've been able to identify her conclusively from that description. And we've been able to see what she did when she came in and went out. That information I can share with you off the platform, because obviously this is something that needs to be investigated thoroughly. But I just want to assure you that her arrival at Lancet to collect the result, what happened while she was on the premises is all on CCTV. Okay? What we don't have is what happened outside of the gate. That we don't know. But what happened within Lancet, we've got CCTV, which shows the time she arrived, she went out, and she came back and she went out. All that is very clear. I will not share with you what's on CCTV here, but we can always talk, off camera. I hope you're satisfied with that answer. So, no, what I'm saying is what she said happened and what we have is there, okay? And I'm quite happy for you to come over at some stage and to look at the CCTV and make your own conclusions, okay?
Okay, perfect.
Now, so the other thing that I want to mention is that all these COVID testing centers that are busy like Lancet, particularly Lancet, I think, there are people that are called touts that operate outside of the premises, okay? They're the same people that you see at Passport Office and these other institutions that may have alternatives for you if you're in trouble, okay? Now, these people have nothing to do with Lancet, okay? There are people that are obviously doing criminal activities outside of the premises of Lancet, and it's not our responsibility to actually police those people because we're actually so busy inside to make sure that we're doing things that we're supposed to do. So I just want to maybe highlight that element that, this lady, she may have a genuine complaint, but, there are many, many things that could have happened, And what I'm saying is we're investigating, and I would suggest that when you've got time, we make an arrangement for you to come around at Lancet. We look at the CCTV footage and juxtapose that to what a narration, a description of what she says happened while she was at Lancet. Okay, I think that's fair enough for herself and for ourselves. Yeah.
Yep.
If you can collaborate what she said, I'm quite happy for you to go and publish that in the press. But if you can't collaborate what she says, obviously, I think it's important to also correct what she said.
Correct.
Okay. I'm not saying that she's lying, but I'm just saying that what we see on CCTV is important for anybody who's going to write a report to have access to that. And I'm free to actually give you access to that.
Okay. I'm answered. Maybe we can, yeah. Thanks.
Yeah. Then your second question was to do with market share. Now, the Ministry of Health Epidemiology Department, which tracks, the status, the COVID status, has got Lancet at the bottom of their daily reports. I'm sure you've seen that. They've got daily reports that they issue. The only private lab that is actually highlighted on that report is Lancet. Lancet is the only lab in the private sector. All the labs are recorded, by the way, because we have to submit returns on a daily basis. How many people have we tested? How many are positive? And of course, we then have to identify who is positive, their cell number, their ID, and where they live for trace and isolation purposes. That's the Ministry of Health has to do. So that information is available on a daily basis. So on a daily basis, I know how many clients have been tested throughout all the Lancet labs in the country. And also information as to what the other labs are doing. All I can tell you without going into specifics is that Lancet probably does 2/3 of the testing that is done on the public. Okay. I think it's to do with our coverage. We've got wider coverage than most of the labs. And also, our brand, I think, has demonstrated quality over the years. Okay. In spite of the recent issues that have come up, our quality is well recognized. We've got ISO certification in molecular biology. But of course, no system is perfect. I'm not saying that the whole establishment within Lancet has got honest people. You may have one or two bad apples. That will occur in any organization. And of course, the responsibility of management is to try and identify those sort of people. That's why I go back to the issue about this lady not having taken time to just walk into the reception and say, can I see the CEO or the general manager? Okay. Would have then dealt with the issue there and then, identified the individuals that she had alluded to. And obviously, if the people that are not Lancet employees, would have called the police. If there are people that are within Lancet, obviously would have taken, stand measures to deal with that. But, her story just appeared on social media. And of course, it was very distressing for myself and my staff, given the amount of service that were given to the people of Zimbabwe on a daily basis, at risk to ourselves. And, so it was really, really shocking that, would be portrayed in such a manner by somebody who easily would have actually said, can I see the manager? And she speaks very well. She writes very well. I think she's a highly intelligent young lady. That just surprised me that with this sort of serious issue, which she took so much exception to, I would have expected her to, at least do something at the time. But anyway, so what I'm saying is you are free to access the video and then we can take it from there. I can't remember what the third question was.
I think I was actually going to paraphrase. No, not really. I think it's all pertinent information. Limbikani, I think your third question might also tie in to one of the questions that Lincoln is representative of Zim Papers Group, so that's the Herald and Sunday Mail. Lincoln, did you want to throw that in, or we can just give you your platform separately?
I think we can do it separately.
No problem. Limbikani, do you feel you've been answered, or shall we move?
The third question wasn't answered. So,
sorry, can you just repeat the third question, Limbikani?
The third question was if you were to get a COVID test, a PCR COVID test result, and you're not aware of which lab did the actual test, how confident would you be that that test is not a false positive or negative?
You know what, the way I would answer your question is that, labs are like doctors, There are some doctors that are highly recommended, some doctors are not highly recommended. Zimbabwe has got numerous people that are providing COVID testing systems here. And as you know, I think the ministry at the moment is on a campaign to actually validate the licensing that these people have that would enable them to do PCR testing. Just speaking on behalf of Lancet, when we started testing for COVID, our labs were inspected by WHO, CDC, and the Ministry of Health. Went through that process, a rigorous process, before we were allowed to start COVID testing, because, of course, of the implications of what results would mean. Most people who look at COVID results, for whatever reason, know the players that they've got, what are reliable results, I'll put it that way, whether you are here or overseas, So I think, it's a question of the person looking at the report. They usually will know the validity of the report from its source. That's why some airlines and some institutions will only maybe look at certain, results. They do not look at results from other service providers, according to their own sort of, assessment of who is doing the COVID testing in Zimbabwe.
Okay, I'm answered. Thank you.
Thank you.
Okay, I think we've got Gwasira, who's got a few questions. Gwasira is from Health Times. Michael?
Yes, Doc. My name is Michael Gwarisa from Health Times. So I have two questions. The first one is on the issue of the false negatives. I just want to hear from you as Lancet. How prevalent is this issue of false negatives within your laboratories? How many? I would say, maybe we might not have the number off cuff, but how prevalent? At what intervals do you encounter these? Then maybe my second question is still on the viruses. You said that the new mutations actually probably the reason why the country could be experiencing an upsurge in false negatives. So I just want to hear from you which variants are we encountering in Zimbabwe? Was it the UK variant, the Brazilian one, and the South African one? Which one is the most prominent in Zimbabwe? Yeah,
okay. What I'm going to do is I'm going to allow Garikai, who is involved in the supplying of COVID testing materials in partnership with our supplier in the US, and he'll just go over the mutations and the sort of things that we pick up with the kits that they are supplying us. Now, if you remember, I said the sensitivity of a test is how good it is at reducing the number of false negatives. Okay. Now, unfortunately, with COVID testing, not only here but all over the world, it's realized that false negatives occur, and we try to minimize them by making sure that the collection of the sample is really the most critical bit at the beginning of this whole process. If the people that are taking the samples are not adequately trained and are not collecting samples ideally, you're going to run the risk of a lot of false negatives. Okay, that's very important. And then, of course, within the testing machine itself, okay, because the kits that we use zero in on specific targets within the genetic makeup of the virus. There are many different targets. There's the spike protein, there's the nucleus protein, there's the membrane protein. So these cyclers pick on these various components of the genetic material within this virus and are highly specific as to which component of that virus they're actually targeting. Now, the mutations that we're describing at the moment are to do with the S gene, that's the spike gene, that's on the surface of the COVID virus. That's where the changes have occurred. Now, if you're using reagents and equipment that cannot collect or identify these changes in the spike gene, you're going to report these cases as negative when in fact they are positive. Okay, and fortunately for us at Lancet, the machines that we're using and the kits that we're using can pick up the three variants: the Brazilian, the South African, and the UK variants. All of them were able to pick. There's no problem with that. Hence, now when somebody goes to another lab that may not be able to pick up these variants, they'll get a negative result, and then they'll obviously think that Lancet has given them a false result, when in fact what they've got from this other lab is actually a false negative result. So in terms of specificity, I said specificity is almost like 98%, and sensitivity drops down to about 95%. In a good lab, it's about 95%. But in some labs, if the processing and the collection of samples is not good enough, it may drop down to even 80%. And of course, that's not good, because you then have a lot of people that are actually positive, that are walking around with false negatives. And obviously, the implications of that is that they then spread the virus. Maybe your question about the kits, maybe I can just ask Garikai to comment briefly.
Yeah, no, thank you. Thank you so much. I think, Dr. Muronda, you've done a great job in just explaining what's happening, especially around the variants. So my name is Garikai Govati. I represent a company called Biomim Inc. So Biomim is a US-based diagnostic manufacturing company. They have been in existence for the past 10 years. And obviously, they have been doing this for a while as individuals before they came together. And the idea here of Biomim was to really create a platform that gives results in any diagnostic environment within minutes, and also you can operate it without lab requirements. And one of the things that they really focus on is really to use technology to do that. So Biomim's test kits for COVID, they got FDA approval, and also they have Health Canada approval. Dr. Muronda speaks around the specificity of these tests being 98. We just ran another validation in South Africa where it was 100%. So basically, these tests are very much highly specific, and sensitivity is around 98%. And they're being used in Canada, and they're being used across the US in many airports. So mostly around travel because of the way they're set up, but also they're being used for admissions as well as regular testing. So they ran the validations to understand the variants, the new variants that came out of the UK, South Africa, and Brazil, and they found out that they have 99 to 100% correlation in terms of detecting the virus. So what the FDA announced, and Dr. Muronda alluded to it, is that if you're running a COVID test and your tests only detect one target, you are likely to get false negatives. The Biomim test, they always detect two targets, one of them being the spike gene where the mutations are happening. So currently, Biomim is one of the few testing solutions in the world that can detect these new variants, and they're being recommended not only to just keep testing, but also the biggest thing that they're being recommended to do is or they're being put up to do is to really do the test right before the second dose for the vaccine is administered. So they're very much a technologically advanced company, which is basically moving with times and really know what targets to get, and they're not missing any of the new variants that are coming up, especially the ones that are mutating in the spike protein. So that's sort of where we are. We've been working with Lancet. They are our exclusive partner here in Zim. So we've been working with them, and we're basically trying to see how we can improve testing and results across Africa through this platform, which we think is going to be a game changer in terms of understanding the virus. I wouldn't be able to tell you which variants are being detected in in Zimbabwe right now, but I would imagine there will be more South African because of the close proximity and also the travel that happens between the two countries. So that's sort of who we are, and that's what the platform is doing. I don't know if there are any questions that I can address. Kosa.
Thank you, Garrick. I think we'll just move along because our time is getting very limited. Michael, do you feel you've been answered?
Yes, thank you so much. I've been answered.
Okay. I think we were going to give the platform to Lincoln from Herald and Sunday Mail earlier, and then maybe we can go into any other general questions after that.
Thank you. Can you hear me clearly?
Yes.
I just have a few questions for Doc. The first one being that there are concerns about the reliability of the RDT tests. Why is it that we continue administering such tests instead of just relying on the more reliable PCR tests? The other question being, is there in the near future scope for self-testing for COVID-19, just as we have with other ailments such as HIV and diabetes? The other question being, why is it that it's generally pricier to get a COVID-19 test compared with, for example, an HIV or diabetes test? And lastly, given the reports that we've had around the issue of some labs selling fake results, in your opinion, how do you think regulators should intervene in order to arrest this malpractice. Thank you very much.
Okay. Thank you very much. I think the first question was to do with RGTs. These are antibody tests. Just to recap for those that may not understand how the RGTs work. The RGTs basically detect the presence of antibodies within the blood. There are two types of antibodies that the body produces whenever an infectious agent, enters the body. There's the IgG and the IgM. Okay, IgG and IgM, and the two indicate different scenarios. Now, the challenge with the RGTs is that the process of the body producing antibodies takes a while. If you're infected with the COVID virus, it may take up to 10 days before your body actually starts producing antibodies. So if you do take a sample from this person or patient between day 1 and day 10, you can get a negative result. And of course, that is not good if that person is actually infected. Okay, so that's the biggest drawback with the RGT, because it's just you basically demonstrating the presence of antibodies. You're not demonstrating the presence of the virus, which is obviously more significant. Okay, now when you interpret those results, the IgM antibody is the antibody that the body produces at the onset of the illness. Okay, so if you find that somebody has got IgM antibodies are positive on testing, it means that they've got an active or current infection. Okay, if the IgG is the antibody that's present, it means that the IgM is absent. It means that the virus has been overcome, and it's an indicator of a past infection with the virus. So these antibodies indicate two completely different scenarios. And then there are situations where you have both IgG and IgM being present. This means that this person is at the end of the cycle of infection. They have almost gotten rid of the virus, but they're not yet there. But they're almost cured of the virus. But the biggest drawback with the antibody tests is that the window period, that's the period when the body is beginning to produce the antibodies, is too long for that to be of use to determine the status of a person at the time you take the sample. Okay. Now, it doesn't mean that these antibodies are useless. They are useful, particularly in studying the situation in a population of people. Say, if we took the whole of the Lancet group and did these RTTs, and the more IgG positive persons you have in your setup, it means the more you feel that you've had this infection in the past and overcome it. Obviously, if you've got people with IgM on the premises, it means that you've got people that have got an active infection, and obviously you must proceed to confirm that with the PCR. So the RTTs are more useful for surveillance purposes, not really for managing, an active or someone suspected of an infection. They're not good for screening because you're going to miss a lot of people that in the window period before they started producing the virus. I hope that answers the question on the RGTs. On the self-testing, now, obviously, the testing of COVID has got many stages. I know that in the UK and USA, they've got facilities where, households receive in their mail swabs. They can actually self-swab. In other words, you just get a swab that's sent through the post and you swab yourself and you send it back to the lab for analysis. This is where we are as far as self-testing. The actual testing or PCR can only be done in a laboratory environment where the conditions are controlled using very specific, expensive equipment, and the processes are also done by people that are highly skilled and have to know how to actually conduct this testing system. So for the time being, there is no self-testing as far as the actual process of the sample, but in some countries now, the actual swabs are sent to households where they can actually do the swabbing themselves and, submit their samples for analysis. But obviously, again, the limitation there is that some of the swabs may not be adequate if the person does not take a good specimen. And then the pricing of PCR tests. Now, the law of supply and demand applies in all these things. Market forces determine how these things work. The pandemic kind of evolved very rapidly, and to the extent that a country like the USA, which normally exports these sort of things to other countries, they are not exporting any COVID materials, maybe some equipment, but certainly the test kits and so forth are not available because the demand in the country, in their own country, is so huge they cannot cope. And then you're left with China and South Korea. I think those are the two main sources of reagents throughout the world. Now, because of the extensive extent of COVID in the world, that demand cannot be met. And when you cannot meet the demand, the prices normally go up. Okay, so when we receive these kits, when we buy them at a very high, at a huge cost to actually import them and get them into Zimbabwe. And obviously, we then have to pass on some of that to the clients. That's why you'll see that the actual price for cost for a COVID test in most of the operators in Zimbabwe is around, between 55 and 65, but usually around 60. And then, of course, you may have players that are charging $70 or $80, depending on their circumstances. With time, maybe as the pandemic subsides, the demand reduces, maybe the price will fall. The comparison with HIV has been around for a very long time. The PCR processes are the same, but, it's a condition where now, it's evolved over so many decades now, the prices are likely to come down, and they've come down substantially. COVID will do that in time, but at the moment, I'm afraid, because of the cost of what we actually use in actually importing everything, the equipment, the reagents, and so forth, the price is high. You will know that our price is no different from other countries in the region. I think if you go to a private operator in South Africa, you're likely to be charged between 900 and 1,400 rands for a COVID test, and that equates to about $60. So, Zimbabwe is not like, extra expensive. It's just and if you go to the UK and you want a private COVID test, you're going to be charged £150, But the difference, I think, with these other countries where public health systems work and are funded well is that in the UK, you can get a COVID test from the public fund, but obviously it's not readily available. You may have to wait to get it. But if you're sick, you get it done very quickly. That option is not easily available in our country for obvious reasons. That's why it may be cheaper for somebody who is on the NHS in the UK. But if you want a private COVID test to travel to Zimbabwe from the UK, you're going to pay £150, And if you want to travel from Zimbabwe to go to the UK, you're going to pay around $60. So you can see the difference there. And our prices compare with South Africa. Now, the other question was about fake results. Well, you know what? When there's a demand for anything in any country, there are people who will come up with schemes to make money using criminal methods, The stories that we hear is that if you go to bed with Border Post, there are people that actually move around with wads of COVID certificates that they sell at nominal prices to people that are going across the border. And I think a lot of that happened probably around Christmas and before Christmas, and that increased the sort of rate of spread of the virus both in SA and Zimbabwe. Because now the control of that sort of scenario obviously is beyond Lancet or any of the other labs. You see, if we issue a result and then somebody takes that certificate and then they produce their own, which is almost identical to the Lancet certificate, it's a challenge. But what we've done now is we've come up with a new COVID report form, which has got a watermark in the number and a sign on it. which is, very difficult to counterfeit. But obviously, criminals that are determined will always, get there if they're really determined. There are also, I think, a lot of IT software engineers who are working towards a platform where results are loaded onto the system, and then when you get to the airport or wherever port, the system already contains your COVID certificate, and there's no need for you to produce a paper copy. So the issue of fake results is something that we try as much as possible to go around, but I'm afraid it's not 100%. We cannot overcome that problem 100%. And to a large extent, I think the authorities have the responsibility of dealing with that problem, with our help, of course.
Okay. Thank you, Doc. We've got less than 5 minutes. Is there anyone who feels a particular burning question hasn't been addressed or hasn't been attended to? I think you've been very, very comprehensive around the issue of your processes, your systems, and even in making us understand the whole physiology thing. I think, we felt like we're in a medical trust there. Thanks for that. So is there anyone who'd like to raise their hands and just let us know if there's anything that they really would like their audience to hear that's not been addressed? Great. I think that's actually a good sign. Okay. Limbikani, I think, okay, maybe can you, Limbikani, I'll give you the floor only for just 1 minute so that we have the last remaining 2 minutes to round up. Our call is only left with 3 minutes. So just 1 minute to ask and be answered.
Okay, I just wanted to get some clarity on the, I know you touched on it, the profitability or unprofitability of COVID-19 tests for Lancet, and what impact that has had on Lancet business in general. Like, is COVID-19 tests now 50% of business, or is it 5% of the tests being done there?
Yeah, you know what? Thank you for that question, Lipikani, because people think that we are just doing COVID. Lancet is actually, in the private sector, the backbone of pathology services provision. With the collapse of health services in the government sector, a lot of people now depend on Lancet for that service. I'm talking about non-COVID work. For instance, biopsies that are taken from people in places like Aranda, Mashingo, and so forth, actually come to Harare for us to analyze and issue reports that determine what sort of treatment that person has. Patients with cancer of the cervix, which is so rampant in Zimbabwe at the moment, cancer of the breast, they depend on Lancet actually for answers, for the diagnosis, and how these patients are managed is all information that we're providing. But obviously, all these other things are overshadowed by COVID, but we are there.